Hello again, this is Dr. Calder from Zurian Medical, checking back with everyone on some topics related to hair loss and its treatments. Today we wanted to speak about a couple things. One is the non-surgical or medical treatment of hair loss, and specifically we wanted to talk about the role of compounds that inhibit DHT formation, dihydrotestosterone, the primary culprit in hair loss, and the effectiveness of therapies in reducing this compound and in so doing preserving and maintaining health of hair. Finasteride is the medication that has been used for decades successfully in this regard, formerly known as Propecia. It is available almost exclusively now in generic form as Finasteride. It's a medication that's taken daily. It is effective in a large percentage, majority percentage of individuals, men with androgenetic alopecia or genetic hair loss. It does have a side effect profile, as all medications do. Fortunately, it is a low incidence side effect medication with regard to any side effects of note. The one we hear most about from individuals that have looked at this medication and are considering it is the prospect of some disturbance in sexual performance as a result of taking the medication. This is a recognized 2% occurrence, can be as low as 1% if individuals are experiencing the side effect and stay with the medication for a period of weeks. It goes away in about half the instances, reducing that percentage to an effective 1% number. And this has been steady for decades and decades of observation. The more concerning possibility of a long-lasting side effect, even with stoppage of the medication, was raised as an issue a number of years ago, has been studied with still some controversy as to the legitimacy of this, but it has caused everyone that prescribes finasteride, including the physicians here at Zurian Medical, to speak about this topic to patients so that they have a good informed notion of risks versus benefits when they're considering therapy. More recently, we've been looking at the sister chemical compound to finasteride, which is called dutasteride. It is not FDA approved for the treatment of hair loss. It is FDA approved for the treatment of BPH, or benign prostatic hypertrophy, but we've known for a long time that it is a more capable, more potent, more effective DHT blocker than finasteride because it blocks, in addition to the two isoenzymes that finasteride blocks, the additional third isoenzyme. So you get near complete blockage or elimination of DHT as a result. And along with it, greater effectiveness in terms of treating hair loss. The reason why in years past we had not resorted to it primarily and kind of held it in reserve was the concern that perhaps it had a higher incidence of side effects than finasteride. But the good news that we wanted to relate to all of the Zurian Medical patients and the population at large is that by virtue of its longer half-life, with dosing that does not have a patient using the drug every day, but more typically in our groups, twice a week dosing, the side effect profile is no more prevalent than with finasteride. So the prospect of dutasteride orally as a more beneficial and not any more problematic drug than finasteride is the news that we wish to announce today.